This is Dr. Muhammad Abu Bakr, consultant physician, TX Hospital. I have been practicing since last 25 years. Most of my patients are diabetic patients, and they come to me for before Ramadan for preparation for the fasting. And we encourage everybody right from 10 years of age to 90 years person to do fasting, as it is very important for it is one of the pillars of the Islam. And those who are fasting since a long time, and if they become diabetic, they are having some myths and all that. So I'm going to clear that. I'm going to talk on that topic. Who should not fast and who should fast, and who should fast with what precautions they are going to do. So first, coming to know about basics of the diabetes. The patient should go to the doctor before beginning of Ramadan, at least 2 to 3 weeks before the Ramadan. Patient should check the hemoglobin A1C level, fasting, post-lunch blood sugars, consult the doctor on time. If the patient's A1C is more than 10, he is not the right person to do the fasting, because A1C also takes at least 1 month time to come down below 10. If it is more than 10, because there are going to be a lot of fluctuations if the A1C is more than 10, such patients will have morning fasting more than 250 blood sugar, post-lunch maybe 350 or 400, and sometimes they may land up with severe hypoglycemia also. So prior medical examination by the concerned family physician is very important. At least family physician knows about the background of the patient, which tablet he is taking, which insulin they are taking. So visit prior to the Ramadan is very important. In this visit, family physician will decide whether you are really fit for fasting or not. Individual advice from your physician is recommended, as she or he knows your medical history. The doctor will advise you on the frequency of monitoring blood glucose and on how to stay out of a crisis. Follow a healthy and balanced diet as suggested by your physician before the Ramadan, not from the day of Ramadan. Before 1 to 2 weeks, you should start preparing for the Ramadan. Continue a routine exercise to maintain normal level of physical activity towards good health. What is safe fasting? During fasting, don't skip Sohar or Sahri, your pre-dawn meal. People, they are fond of skipping the Sahri. They stay awake till late night, 2 o'clock, and they finish the meals before 2, and they skip the Sahri and they continue the fasting. That fasting will become almost 18 to 20 hours. So they should avoid it. Fasting should be done in a proper disciplined way, wherein the Sahri or Sohar is around 4 and 4:30. You have to finish that breakfast meal or Sahri, and on time it should be done, and as per the requirement of the individual it has to be done. Don't be in hurry to eat excess in the Sahri. Take one. If you are taking 2 chapati, that is enough. If you are avoiding rice, I think that will be sufficient. If somebody doesn't want to eat chapatis, they can have a small 1 cup of rice in the Sahri, and some salads and other things. Drink at least 8 glasses of liquid water. It should be sugar free. Monitor your blood glucose levels or severe dehydration while fasting. After fasting, breaking of fasting should not be delayed. Iftar should be done on time. Sometime you are out of your house, traffic jams and others, you may reach very late to the house somewhere. If the iftar is around 6:50 p.m. and you are reaching at 7:30 or 7:45, if there is a delay of more than 20 minutes to half an hour, you may go into hypoglycemia. Hypoglycemia is common only once the iftar is delayed. Otherwise, during the fasting hours, if you have done a proper Sahri and you have taken a proper advice from the doctor, then hypoglycemia incidence is very unlikely during Sahar to iftar. So what is hypoglycemia? Hypoglycemia is blood sugar going below 63 at any given point of daytime. It is hypoglycemia, whether it is symptomatic or asymptomatic. Symptomatic hypoglycemia patient experiences the symptoms like hunger, anxiety, restlessness, blackout sensations. Then he will correct it by eating something. Stage 2 or symptomatic hypoglycemia, which is recognized by family members. Family members are seeing that the patient is not responding, is blank look, or he fell down, some unconsciousness. Then stage 3 is patient is brought to the hospital in unconscious state. Patient requires hospitalization. It could be a neuroglycopenic symptom. Maybe the patient might have had thrown fits. So these are the symptoms of hypoglycemia, which are very unlikely if you follow a disciplined type of life during Sahar and during Iftar, and eat in moderation. Don't eat excess or don't eat less also. If you consult the doctor on time before fasting, the doctor may advise you about how to reduce your medication before the Ramazan. Suppose you are taking some medication like insulin, you are taking 2 times daily, and morning dose is around 20 units and evening dose is around 20 units. Of course, you are the candidate if your A1C is below 10 or 8 or 7 or 7.5, you can do fasting. But your insulin in the reduced to almost 1/3. Suppose you are taking 20 units, you can take 6 to 8 units with Sahar, depending on your meal. If you are overeating in the Sahar, or if your sugars are very high in the Sahar, you can take the normal dose. Otherwise, try to skip the insulin in the Sahar. That is the safest option. The same extra insulin can be taken with Iftar. So you just add another 10 to 20 units of insulin with Iftar, extra dose or correction dose. Then you can continue fasting. There won't be any risk of hypoglycemia during the Roza or Sahri to Iftar. Regarding the tablets or medication, somebody is taking only one tablet a day, wherein the blood sugars are very excellent control. That is like a common drug which is prescribed for diabetes is metformin. If you are taking only metformin 2 times daily, and if your A1C is around 7, I think you're the candidate. You're the best candidate for fasting, and you can stop any medication during Sahar. You take the single tablet of metformin with Iftar. If it is 1000 mg, you take 1000 mg. If it is 500 mg, you take 500 mg only. And the ideal time for taking the tablet after Iftar is first you finish the Iftari or fruits, break the fast, eat the fruits, then take the tablet. Then after half an hour you can have your dinner. Don't eat immediately the dinner once the Iftar is over. Just give some 10 to 15 minutes time and take the tablet during that time, and check the blood sugar levels during Sahri and Iftar. After the Iftar, if the sugars are fluctuating more than 300, don't skip any tablets. Try to bring down your excess carbs in the Iftar. Excess carbohydrates are everything which is fruits is nothing but carbohydrate. If you are eating fried items like the bada or samosa and other things which contains a lot of carbohydrates, if you are having Iftar party, you will end up eating biryani. You don't eat that biryani in full quantity or full plate. You reduce it, you make it half. Next day you can have that same biryani. Otherwise your sugars will go more than 300 and you will feel very weak during fasting on the next day. So please don't allow your post Iftar sugar to go beyond 200. If it is below 200 till Sahar, it will be fine. And at Sahar you don't need any medication and you can continue the fasting, and your Roza or fast will be completed, or you can complete 30 days fasting without any trouble. Suppose somebody is taking more than 2 tablets and 1 basal insulin. So that basal insulin can be continued after the Iftar or at bedtime. Those 2 tablets, suppose if the tablet is sulfonylurea along with metformin, then please avoid sulfonylureas, glitazones and any other drug which can cause hypoglycemia with Sahri. All these tablets can be taken together with Iftar, because once the Iftar is over, you can eat whatever you like, and even if you experience some symptoms of hypoglycemia, you can correct it. Then how to manage an incidence of hypoglycemia during Roza. Hypoglycemia, if you get blood sugar levels, please check the sugars whenever you get any of these symptoms. Symptoms are giddiness, sweating, numbness, blackout sensations, syncope, convulsions or fits. So if you experience any of these symptoms, please do immediately the blood sugar testing, and correction of hypoglycemia should be done within minutes. If you are fully conscious, please eat something. If you are not conscious, take the help, or somebody should help and take you to the doctor or to the emergency room for immediate correction of hypoglycemia. Hypoglycemia, if it is not corrected within 10 to 15 minutes or within half an hour, there can be prolonged hypoglycemia can damage your brain, and some intellectual functions may be impaired later on, and you may get regular seizures also if the hypoglycemia is not corrected on time because of the damage to the brain. So hypoglycemia is the only complication which is seen in less than 1.5 to 2% in global studies, which was done 3 to 4 times by an epidemiological study of diabetes during Ramzan. I was a part of it. I was a principal investigator for EPIDARE, study of diabetes during Ramzan globally in most of the countries, and even in India it was done, and I was a part of it. So in my opinion, fasting is very good for diabetic patient to avoid the excess eating, to avoid the overeating, after consulting the family physician. Family physician plays a very important role. So please don't take medications on your own without consulting the family physician.